on the bottom of my screen that's not actually red, but it is recording now. So let's go ahead and get started. This is exciting because I really want to hear about today's topic because I'm involved with it and I want to know what we're doing. So that's why we invited Ricky to be here. I'm just kidding. We're going to talk about the Partnership for Success grants, which is really exciting for community partnership, in that we were fortunate to receive this on two ends. One, a grant that will help us to really saturate prevention in Greene County. And then we are part of a broader connection to the state of Missouri that will help us to connect to our entire service region. So not only will the PFS grant really bolster prevention initiatives right here at home, so to speak, it's really going to help us to launch into the 21 counties that we serve in Southwest Missouri. So it's really kind of neat. And Ricky and I talked about this a little bit, and then Jillian Latimer, who's on my upper right hand of my screen here. I don't know where she is on yours, but Jillian's new to our staff, or Jill, and she's leading the initiative for the Greene County PFS. So what we want to talk about is just some broad strokes of what is the grant, what it hopes to accomplish. And of course, like we all know, with any grant, there are stipulations. We're going to have to adhere to whatever was written for. Those are the guidelines. But I don't think that it excludes anyone that's in the Southwest region of the state, because in some way or another, we're going to have some messaging that goes out. We're going to cover a number of counties with the effort that Ricky and I are undertaking. And so that's what's kind of exciting about this. And I'm always looking for feedback and ways to do prevention better in our area. So we didn't really rehearse this in any way, shape, or form, but I thought we would start with Ricky talking just a little bit about how this whole idea for PFS, I mean, it's a SAMHSA grant, but how we ended up getting included in both of the final outcomes. Ricky's been connected with that since the very beginning, so I thought she could talk a little bit about that.
Well, sure. So, whenever grants like this come along, especially coming from SAMHSA, it's certainly something that we look at because it helps to just bolster the work that we are already doing. And so when we saw the release, well, and just for complete transparency, we applied for the Partnerships for Success last year, and we're not awarded it, but that was when it was changing. It had shifted for the first time from being just a state level grant to being actually able to be applied for at the community level. Well, then we reapplied this past year, made some changes based on our application the previous year, and so we knew that we were kind of in a place where we understood what they were looking for a little bit better and understood what that might mean. And so we decided as community partnership that we would apply for that specifically within Greene County to help to bolster, I know Jill will talk more about this, but really bolster the infrastructure of prevention work happening here. We have been doing prevention work for almost 30 years with community partnership in our Southwest region, but over time, things can get a little bit stale or things can get a little bit stuck. And so we're excited to have a grant that will reinvigorate that and really look at some key things. And I want to steal Jill's thunder and talking about her own grant. So there was that aspect of us applying, and then the Missouri Department of Mental Health also applied. So this was a federal grant that received applications both from states as well as from community organizations. So they set aside a certain number of grants that would be awarded to states and then a certain number that would be awarded to communities. Well, Missouri is actually only 1 in 5 states in the United States that were awarded the bigger federal grant for the state implementation, which is really exciting. And they had approached us. They did some data assessment early on when they knew that they were going to be applying, and they decided to go ahead and include us because of our regional data on various topics, various pieces of substance use. And so they approached us and asked us if that would be something we would be interested in looking at based on the data. And so we said absolutely and gave them whatever they would need. And so that kind of resulted in this very interesting year where we put in our application, they put in their application. And as with grants, you just then sit and wait for a very long time until you find out about that. And so that was an exciting day when we learned that we received one as community partnership and then also as the state. So that's kind of the journey of what earlier this year looked like and the application process and thought behind it. So what we decided was that the state grant, which we are now calling our regional grant, would focus outside of Greene County. And we'll get into more details on that in a minute of which counties we're going to be addressing, but that would kind of be, we'd look everywhere except for Greene County since we received the grant for Greene County.
Okay. Jill, do you want to add a little bit just to add on to that about, maybe what the scope or the focus of the Greene County initiative's mission is to be?
Unmute myself first. So the Greene County Partnership for Success grant is kind of like Ricky said, that 5-year federal grant from SAMHSA. Our focus is going to be the prevention of underage drinking, obviously ages 12 to 20, and then also tobacco and vaping prevention for ages 12 to 20, and then prescription pain medication and other opioid misuse for ages 12 and older. So that is kind of in the way that we're going to be working with a lot of those Greene County coalitions that are already started and up and running. We'll have a lot of teamwork there because that's going to help us achieve our second goal, which is really to improve upon the prevention infrastructure in Greene County. In a way, make sure that there's, not duplication happening, enhance kind of the communication between all of our coalitions. So an example in the grant is one of the things we wrote was enhancing policies for parental notification for college students that are caught with substances. Well, that's easily something that our underage drinking task force can be super interested in, but also our Greene County tobacco and vaping. So if they both want to achieve that, we really hope the PFS grant is going to be an easy way for us to combine forces and really work together to achieve goals. That way, you're not working really hard on something and they're working really hard on something, but together we can just blow it out of the water when we have double our resources. So that's kind of what our scope is. Definitely, trying to just build our community collaboration, which right now means that we're working on having a lot of one-on-one meetings and building those relationships with people, so that hopefully we can just take this PFS grant and run with it.
Thanks, Jill. So, from the very beginning, when they sent the letter from the state and Ricky shared that with our staff and I read through it. This is an oversimplified way of looking at it because Ricky already said we've been doing this for 30 years. It's not like we don't understand prevention. The oversimplified way of looking at this is really just doing what we already do really well, even better. It's like prevention on steroids in the areas where it's going to be implemented. Greene County for one, and then we have filed our assessment with the state. It hasn't been approved yet. They sent it back with some revisions, but we're going to be as far as regionally, we're going to focus in on 7 counties really strategically. And just like Jill mentioned, we're going to look at underage drinking, marijuana use, and the use of tobacco around perception of harm and the enforcement policies and practices. And then, also what parents think about it. And then one of the interesting things in our assessment we pointed out is we know what the perception of harm is, and a perception of availability for the kids is. We don't really know what mom and dad think about that because we don't really have data that asks them specifically like we ask the kids every 2 years. So that's one of the things that we're kind of excited about learning is what do mom and dad or what do the caregivers think about these substances and access to them by their kids. The other part, and this was what really attracted me to wanting to take a leadership role in the PFS grant, is from the state's perspective, we're going to also get to delve into Search Institute's 40 developmental assets, which is really what I've loved from the very beginning. I mean, community partnerships been dabbling with assets for as long as, well, way before I got here. We called them building blocks back then, but they were still the developmental assets. And so now we're getting a chance not only here, but it's a statewide initiative to really reinvigorate the focus on those assets. And I think it's perfect timing because the topic of conversation at our state conference Monday and Tuesday this week, there was a lot of discussion about the ACEs studies. And I think that ACEs and the developmental assets really dovetail together when you start talking about building, better resiliency. The other part is, and it's something that's been under the radar for a few years now, is the state's perspective on this grant is to start talking about methamphetamine use reduction, which is something that I know Philip Whiteman's on here. He's former law enforcement, and he'd probably raise his hand and say, yeah, methamphetamine never went anywhere. They stopped blowing things up, but they never stopped using it. And the state sees that data and says, we need to find some places in our region where we can take a look at that and start to reduce some of the use of methamphetamine. And then the last part of the state's initiative that really is kind of like, I think it's one or two sentences in the grant, but it actually says that based upon research or a survey taken by prevention specialists across the state, those of us that work in this industry, they wanted more like professional development. And that's part of this grant as well, is to kind of bolster access to more opportunities for people in our role to become better at the jobs that we do. So that's why I say it's really about prevention on steroids. It's not just about the communities. It's about those of us that work in those communities becoming better at the jobs that we do. And then the exciting part is not just looking at the risk factors and substances themselves, but for me, really looking at those protective factors and getting into the developmental assets. So it's going to be a really interesting 5-year period. And I think we're off to a great start. So I'm want to open it up to Jill or Ricky, just if there's any other thoughts that you have about, kind of like fleshing out the impact or of the grant or what it's designed to do, and then we'll start maybe taking some questions about it and move on from there. So Ricky or Jill, either one of you, anything else you want to add?
I think, well, I think we could probably announce the counties that we're actually going to be in, which would be exciting for a regional grant. We know Greene County, but I think one of the interesting things that Steve and I talked about. So for those who don't know, Steve moved from a prevention specialist role into the project director role of the state grant, and so he had to do this deep dive into data very early on. For those of you who have gone through our substance abuse prevention skills training, that strategic prevention framework, I mean, Steve is going after that on a very, very, very practical and real level to, because essentially what the state wants from us is a full-fledged assessment, capacity, planning, implementation, evaluation, including cultural competency and sustainability plan by early of 2021, so that they can go ahead and submit that to SAMHSA as what we're doing in our region. And so he did this very deep dive into data and looked at a lot of really interesting pieces of information, some using Missouri student survey data. And then of course, when it came to methamphetamine use, like Steve said, it's kind of one of these things that when labs sort of disappeared in Missouri, I say disappeared, I know rural areas, that's still a problem, but people kind of stopped. And when the opioid crisis kind of picked up, it's like methamphetamine took a back seat. When it comes to youth use of opioids and prescription medications, that is always the fourth topic of use for youth. It's always alcohol, tobacco, and marijuana. Those always are the top three, and then prescription drug misuse. But when it comes to meth, that's not something that typically youth are using. That's a very small percentage of youth. Whereas that becomes more of an adult thing. So Steve and I have had some conversations. The state has had some conversations because there isn't a ton out there about methamphetamine prevention. There's not a lot out there. A lot of it involves intervention, or once they are already in treatment, preventing, relapse and all of those aspects. And so it's going to be a very interesting thing, because that's not typically a substance that you say to someone, hey, don't use methamphetamines. It's really dangerous. It's just not something that typically, like, we may say that about alcohol, like binge drinking, or vaping. We go over, the harms of vaping and what it does to your body. That kind of education is different. Methamphetamine, there's typically already an addiction in place. There's typically already, some things happening there that have led to that. And so it's going to be an interesting process for us. There's an old program called Meth 360, and we're going to take a look at that and look at revising that and revamping that. So that will be really interesting too. But getting back to the data on the alcohol, tobacco, and marijuana and prescription drugs that Steve did a deep dive into, a lot of these counties that we've addressed had some really startling data, to be honest with you. Steve took 2020 data and 2018 data and 16 data and looked at upticks and the percentage of increase in that time frame. And some of them really stood out, upwards of 40% increases, 60% increases in some of these. And so that's what really brought those to the surface. So the counties that we're going to be addressing, Steve, can I share, or do you want to share?
No, by all means.
All right. So we're addressing the enforcement of tobacco and marijuana. Those are two of our intervening variables that we're addressing. We're addressing enforcement of tobacco and enforcement of marijuana in Howell County, Ozark County, Polk County, and then Scott, Webster County. I know Scott will be happy to hear we'll be out there hanging out with him. And
Hey.
and then we will also be addressing perception of harm of alcohol.
Alcohol.
Thank you. Okay, I had a brain moment there. In Webster, in Polk, Howell, Dallas, and Berry counties. So there's overlap between a couple of those counties, between all three intervening variables of enforcement of tobacco, enforcement of marijuana, perception of harm of alcohol. But then there's some that kind of stood out, like Berry and Dallas stood out with the alcohol specifically, whereas they didn't on the enforcement of tobacco and marijuana. So it was a really interesting search. And then maybe this is a good conversation point, I don't know, but the prevention efforts around perception of enforcement are something a little bit different for us. We haven't typically focused a lot of our prevention work on addressing perception of enforcement. It's typically been availability and trying to make drugs less available to youth, increasing barriers, and then also a lot about perception of harm and community norms and trying to just change opinions about that. So it's kind of an interesting thing. So perception of harm is going to be, or perception of enforcement, I'm sorry, is going to be a different approach for us in helping them. And certainly with marijuana, that adds a very interesting take, because what kind of enforcement is happening with marijuana. But Steve and I had a great conversation about this, that it doesn't have to involve law enforcement. It could be school policies. It could be parental, expectations, things along those lines that are kind of that broader piece there. So Newton County, Philip says they're still cooking it down there. Yeah. So anyway, there's some extra thoughts there.
I don't think you included this, because I don't want Shannon to go away mad, but Lawrence County is also included in that. You said Berry County, but Lawrence County as well.
I'm sorry, I missed.
So just so again, it's Berry, Lawrence, Dallas, Polk, Webster, Howell, and Ozark County. And then the county that was selected, there were several, as we know, there were several counties, or are several counties in Southwest Missouri where methamphetamine could be addressed. And so the state asked us to start small and then build from there. So we were asked to select only one county in which to begin our initial efforts. And the county where we're going to look at methamphetamine use reduction is going to be in Jasper County. And the reason that Ricky and I felt like that was a good place is because we looked at a lot of the interdiction, a lot of the seizure rates. And Greene County does get a lot of that, but Greene County already has the work that Jill's going to be doing with that grant. So we wanted to look beyond that. And Joplin and Jasper County really is not only a place where there's a use of it, but there's a lot of distribution of it. I know it's going to end up down there around Newton County. It's going to end up in Barton County. It's probably going to go over into Kansas as well, but it does end up being distributed from there. So that was the county that we wanted to start with. And then the low, is it low hanging fruit? I don't know if that's the right way to say it. The other part of the grant that they asked us to do is to find or identify 2 areas where there just really isn't any prevention work going on. And the goal there is to get something started, primarily, hopefully a coalition or 2 during the coalition life cycle. So right now that gives us a solid 10 different counties out of 20 that we're going to be working in over 5 years. And um, especially, I know that Philip would know this, being over in Newton County. If you're in Newton County, kids today don't know borders with social media, and those kind of things are a lot easier to overcome. It's going to bleed over into surrounding areas. So I'm really excited and think that we're going to see a lot more reach with this than just those counties by definition or by title. We're going to really be able to do some work in a significant number of areas. Jill, anything else you want to add?
No, I don't think so. Just to say, if you are in Greene County and want to be involved in coalitions, or you have an idea like, hey, I think this would be really great for any of those 3 substances I mentioned, please feel free to reach out to me. My email, I can put my email in the chat. Kind of like Steve said, we do have some parameters that we're limited to in the grant, but I would love to hear any ideas. Nothing is too crazy. We can talk about it, and like I said, really want to focus on the collaboration. So if you're interested, please feel free to reach out.
I want to go ahead and Jill is the project director for the grant, but I want to introduce to everybody, also on the Perk today is Clement. I'm not going to say your last name correctly, so I'll let you introduce yourself. But Clement's new to our staff as well. He's actually the first time that CPO in our history, we hired an epidemiologist. And if you're like me and you have to go to the dictionary and look up what that means,
Tracy and
it
Tony
means
and
that Clement loves to sit
really looked at
and look at data
the financial piece.
and look at data and crunch the numbers and look at it from that perspective. So if you want to, he's going to be the epidemiologist for the Greene County grant. And then we also have one that we have access to through the state, but she actually offices in Jefferson City, or is it St. Louis, Ricky? Where's Ravneet at?
St. Louis.
St. Louis. So we all have access to that, but specifically Clement's going to be working here in Springfield and Greene County. So if you want to introduce yourself, and if you have anything you want to add to the discussion, feel free.
Hi, everyone. My name is Clement Echampong. My last name is mouthful, and that's because it's not American. It's Ghana, West Africa. That's where I'm from originally. And I have my background in pharmacy and public health. And like Steve rightly said, I am the epidemiologist for the Greene County PFS grant. So I always tell people what my role as an EP is in simple terms. I'm basically just a guy that it's supposed to look at the numbers and help kind of diagnose what's wrong with the population, and then help evaluate what we're doing, help assess, make sure we're on track and hitting our target. So if any of you is working on prevention work and need somebody to look at the data, or need somebody to help you with resources on where to look for data, feel free to reach out. I'm gonna also drop my email in the chat box. I'm also new in the role, and I'm also open to suggestions like Joe said, and ideas on where to look as well. I'm still trying to build my network, still trying to get in touch with resources as far as prevention work is concerned. So if you also have any useful links or resources, it could be epidemiologists in other counties or other states, you can also just try to connect me with those as well. It would be good to have that backbone of resources that I can connect with and share ideas and basically transpose all those best practices into what we're trying to do with Greene County. Yeah, thanks, Steve. That'll be it for me.
Thanks, Clement. Well, we've covered quite a bit of ground as far as trying to flesh it out. I'm curious as to there's people on here that are at least new to me. You may work with some of the coalitions that our other prevention specialists are associated with, but if there's questions that you have about what this grant might mean, specifically for your county or your coalition, we'd love to talk about that. So we'll open up the discussion from the participants.
I have a quick question.
Yes.
When you're talking about the perception of enforcement, and I know you kind of went into detail about that, about doing some things in schools, going beyond like law enforcement, but is that more so educating students on what type of enforcement is happening within the school and within the community, or is it more so educating whoever would be enforcing those consequences to maybe have different types of enforcement, or is it both? What does that look like?
I think it's a little bit of both. And another way that Ricky and I talked about this, because, it is, you say perception of enforcement and you automatically think, well, it's the guy with the gun or the badge or whatever, or it's the compliance checks and those kinds of things. But another way of thinking about this is how do you change that community norm? So moms and dads enforce it, schools, policies enforce it, law enforcement enforces it. But what's the community norm? And an oversimplified way of saying it is, well, everybody just does it. Well, that's just a norm. That's just something that, it's been adhered to from generation to generation. So changing the way that you think about that in your community is really what it comes down to. And that covers both those that would be seen as an authority figure and those that are, would be engaging in the problem behavior. Ricky?
Makes sense. Thank you.
Anyone else?
Hey, Steve.
Yes.
And I apologize, everyone, about the camera. I just can't get it to work. Not that you're missing anything. Thanks, Ricky. And I just wanted to share with you at our last coalition meeting, and this was just kind of an out of the blue thing. This kid in Ann Arbor, Michigan, decided to do an assessment on life expectancy for Webster County, Missouri. So he just went and threw darts at a dartboard or something. And one of the anyhow, so we got him to report back out on his findings to the coalition. And one of the things that he alluded to was that if we really took a hard look at doing these things, we could increase the life expectancy of our residents by 3.25 years. And one of the really big things was that he looked at, or that he focused on, was smoking prevalence, which ties into where you're at. So I thought, well, that's interesting. And we had a very small sampling in the student survey this last year, but when I looked at it, we were we were below the state rate on vaping, but we were more than double the state rate on tobacco use. So when you look at tying those things in together, I think that may make it a little bit easier of a pitch. And that was one of the things that we talked about at the coalition meeting, is that as we move forward from COVID, that's one of the things I think that as a county, we really need to focus on. And that then also ties in with the whole enforcement thing, and the expectation and the community norming and all that kind of stuff. So at any rate, so it was interesting to see that kind of data come out, though, that not only can we do good things and keep people healthier and do the right thing and all that kind of stuff, we can ultimately, we're going to start extending the life expectancy of our residents.
Good point, Scott. And that was another thing that, the grant, and from the state's perspective, we talked about, perception of harm and enforcement and so forth around tobacco, but the numbers are significantly different depending on where you look, between the perception of a youth about tobacco and the perception of a youth about vaping products. So that will most certainly become a part of this as we move forward, because today's tobacco is not the same. So nothing's the same as it once was, it seems like. Any other questions?
Steve, I was just going to ask, is more specifically, like with the methamphetamine prevention goals, are we looking at also, as we build those coalitions, trying to find a way to bring resources from that community to where they can be accessed by the families? Because I think, especially with methamphetamine, not many kids are waking up saying, they really want to see if they can get a meth habit today.
Right.
And so the problem is we got to find a way to address those underlying traumas or those underlying generational issues, so that we can not have the problem in the first place.
Right.
I think the meth track would have to look a lot different than the alcohol and smoking.
Yeah, you're correct there, Alan, and I think this is what Susan Depew is the state's director for this grant, and she kind of shared with us that from SAMHSA's perspective, they awarded this grant and they kind of said, we're really excited to see what Missouri comes up with in regards to methamphetamine prevention and reduction, because it really doesn't, that kind of model just doesn't exist nationally. I mean, there's some things out there that have been used, but it's kind of informative. It doesn't really get into an evidence-based type of outcome. And so that's going to be really exciting. And you're correct. I mean, that was part of being involved with drug endangered children for the time that I was, is we even knew that then a lot of what their efforts was how do you do family reunification after there's been an intervention, after there's been a meth seizure or a lab explosion or something like that. How do you work on that? And it was really good work, but it was frustrating because there really hasn't been traditionally anything that looks at it from the perspective that you're suggesting, Alan. It's like, this is probably an older individual. They may have, children that there's to be considered about this. And it's about breaking that life cycle of addiction. And how do you go about doing that? Because if you don't, then you just create the same problem over again. And that was the feedback that we got from law enforcement and from medical professionals. It's like, when you have a family that's entrenched in the addiction of methamphetamine, very seldom is it just one generation. It becomes kind of a multi-generational family issue, moms and dads. And I mean, I talked to some law enforcement that said that it's not uncommon to have 4 generations, grandpa, grandma, kids of kids. And that's what's so challenging about this. But I think it's also going to be very rewarding if we can really come up with something that's significant in addressing the reduction of the use, but also addresses the prevention of other substances. And then quite likely, like Ricky pointed out earlier, they may start dabbling with other substances, and then the next thing you know, it's methamphetamine. So that's kind of makes it an interesting thing to really be involved with at this time.
Yeah, I think all this sounds really exciting. It's going to be really good for our community. I sometimes wonder, especially in the rural counties, when the school counselor, becomes aware of, methamphetamine use beginning or some of this stuff, I think a lot of times they just feel like, well, where do I send them? I mean, if you're in Stone County, for example, where are you going to send, what sources are available? And so if there's any way to try to build those coalitions to build resource connections, I think that would be important. Yeah,
I agree. And I'm hoping that we look at all of that because, like I said, and you were a part of that from in the past when we did have an active drug endangered children's coalition, and that was really what we recognized was, DEC was founded upon that reunification, but primarily out of the meth epidemic and manufacturing. And as that started to kind of, change, DEC wasn't able to really adopt or adapt in the direction that I think we need to go now, and that's been missing since there's been an absence of a focus on methamphetamine, and I'm hoping that in 5 years we can get some footwork established in our counties, communities.
Steve,
Absolutely.
if I might, sorry, Alan.
Oh, no, I just said that sounds really great. I'm excited to see what we can do with it. Go ahead.
I was going to just touch on what you said. You briefly mentioned school counselors, and I absolutely wanted to mention that. I wholeheartedly believe that that should be one of the primary targets for education as our school counselors. They are so overwhelmed with, you name it. In their training, they, of course, deal with the mental health aspect of it, but they don't have the real world. What is a drug? What does this pill look like? What is this bong? The basics in the drug world, they don't have that, just because it's not included in their education. Now, through experience, they'll eventually get to know all that. But I think if we're able to provide more resources to them like that, such like Anna's working on the identification posters for me, and simple things like that would go a long ways with them, because then they're able to identify and then tackle the mental health aspect of things on that, or get them in touch with the proper resources.
Right. Yeah, I think the methamphetamine issue is complicated, because it's all too often it's such a multi-generational. I mean, it's familial, and how do you address the substance, but then how do you also provide the necessary mental health supports, or substance recovery supports and those kinds of things, because it's a challenging substance to recover from, and if it involves the entire family, that makes it even more complicated. So it's going to be interesting to see how we can make inroads with this, because not only do we are going to start, in that Four Corners area, but in the Jasper Joplin area, but then there's some rural areas that we want to also address, and those by default end up being a couple of the counties that we want to have some significant inroads in getting some prevention started, and they just happen to also really need to focus on methamphetamine use reduction. So, other questions? Don't be shy. Now's the time. It's harder to answer your question 10 minutes after we get off than it is.
What was the name of this, Steve?
The grant? Partnership for Success.
Oh, that was the, okay.
Yeah. Mm-hmm. Yeah, they've had one for the state of Missouri in the past, and it really covered for geographical illustration, the southeast part of the state. So more the Boot Hill area, but even further north than that. I don't know how many counties, but they did that, and they finished that 5-year grant cycle as this one started. But the unique thing about this is then this covers that other 85% of the state by doing this. So really, over a 10-year period, the entire state of Missouri has had some sort of exposure to the Partnership for Success grant initiative. So some of I've heard some of the and seen some of the work that they did in the previous grant, and some of that will be carried over, especially around the assets and that kind of stuff, into this grant, because it's really about just getting that information out there. And what I like about for those that don't know the Search Institute's work is, and the same thing Ricky mentioned, the Meth 360, and the way that is designed has the same thing in mind as the assets. Is it just doesn't make it the work of the professionals or the coalitions that are leading these initiatives. It really shows everyone, family members, community members, teachers, preachers, ministers, whoever it happens to be, how accessible it is to build resiliency in the life of a child. In fact, resiliency in the life of anyone. But that's what the assets is about. And Meth 360 really teaches people their role in prevention. It creates an understanding of how devastating meth can be and how addictive it can be. But it also just really tells people you're the ones with the power in addressing this as a community member. And I think that's what a coalition strives to do, is not say it's about community partnership or it's not about a DFC initiative in Newton County. It's about how does Philip, or how do we as prevention specialists empower the community to say, hey, this is not healthy for us. That's that behavioral health model. It's impacting all of us. And so that's what some of those things strive to address. The assets to me are just golden. I mean, when we've done those as community initiatives, people are always like, this is amazing stuff. This is fascinating. And the number one question is where do I learn more? Because I want to get started on this. And what they don't understand is for the last hour, 2 hours, or 3 hours, they've actually been doing it. And it's about really drawing from the strengths from your own life and sharing those strengths with someone else, highlighting those and drawing those out in other people. And it becomes this, what is it? It takes a village to raise an idiot. So it's kind of like one of those things where it takes all of us to really make a difference. And I think that's really true when it comes to methamphetamine. I mean, this is not something that only the professionals are going to address. If the community can't get their arms around the devastation of methamphetamine, it'll be really hard to address it. It's a community problem, at least from my perspective.
I mean, I absolutely agree with that, Steve. How can it not be? It's the negative aspects of it are affecting the community. It's rippling through, like you or someone else mentioned, the generational thing.
Mm-hmm.
One of the last kids I had to pull out of a home, 33 paperwork out of a home, was you literally had 3 generations. You had a baby, you had an older brother. Actually, probably had 4. He had a mom and dad, and then you had their mom and dad, and they're all in there physically in possession, including the baby, of meth and various other products.
Yeah, and that's one of the experiences I had. I was invited to come and talk about drug endangered children. This has been a number of years ago in a rural community here, and there were 14 people there, and they were all civic leaders. The chamber president was there, the chief of police was there, the mayor was there, a nurse was there, the whole 9 yards. And it was set up to be like a 90-minute interaction with this community overview. And the first hour was just all 14 people went around the table and talked about how meth had destroyed their lives. They'd lost a family member, a husband, a wife, a son, a daughter, a niece, a nephew to methamphetamine in their community. And I was just like, I wanted to go someplace and just cry. It was like, and they weren't doing it for sympathy. They were just like, you could feel the pain of how meth had just destroyed their community. And they were like, what do we do about something like this? And it was just an illustration of how powerful this is. But at the same time, how much of a community issue it is. It wasn't that it was a one family that had a problem. It wasn't someone could go, yeah, well, your family's always been messed up. It was like, we're all suffering from this. And I'm hoping that this helps to, start chipping away at that. Other questions? You can always reach out to us after the fact if you have questions about how you might engage with us or add more to the conversation going forward, either with Jill or Ricky or myself. Clement put his email in the chat box if you want to reach out to him as well. We do have, like I said, 2 more Perk conversations in this series. Our next one on the 5th, I hope I'm saying that right, of December, we're going to talk about medication disposal practices, and that will be with Miss Anna Jones, the teacher on the call. And she will talk about some of those initiatives and how different communities, not just here in Springfield, but different communities are really addressing that. And there's been some really cool things that have happened during COVID. So we'll talk about that. And then on the 17th of December, we're going to talk about media literacy. And I'm going to talk a little bit about a project that I did a few years ago. And then I'm trying to get a gentleman from Dover, New Hampshire. Some of you may be familiar with Youth to Youth. It's a youth initiative in their county where they do a lot of media literacy, and I'm trying to get him to join us just to talk a little bit about that. So it's kind of exciting. Any questions, comments, concerns, criticisms? Well, this is the prevention perk. So with that goes the fabulous taste of coffee for those of us that were continuing to imbibe while we were on. I until noon, I don't stop. So cafe up. If you are interested in being the recipient of the best tasting coffee in America, just in my opinion, it's from Big Mama's Coffee here in Springfield. I have a certificate that would have your name on it. So if you're interested in being the recipient of some delicious coffee, pick a number between 1 and 100 and put it in the chat, and the closest number to 100 will enjoy. And they do have tea. Somebody said they had their tea this morning. I don't remember who that was, but they do have tea at Big Mama's as well.
And the world's best muffins, right, Steve?
Well, I'm not going to say anything about the blueberry muffins, but
Gotta get a blueberry muffin from there.
I'm kind of a snob when it comes to that. Still a few more coming in. Everybody weighed in that wants to be. Three, two, one. Okay, I don't know who Erica Little is, but Erica Little was the close. What's that?
Hello, thank you.
Health department.
Yes, I'm the administrator of chronic disease prevention at the health department.
Oh, well, congratulations. If you're a Big Mama's fan, they're going to love to see you come through their door. I have a certificate for you. You were the closest number to, actually the number of people that logged on today was 19. So you were 36. So
Well, thank you.
Keep it away for next time. People are going to
What's
get
that?
participants next time.
Any other questions, comments, concerns? All right. Thanks, everybody. It was good to see you on here, and join us next time. We'll talk about medication disposal. Have a good day.